Every year, 800,000 people in the United States have a stroke. Strokes kill about 140,000 Americans each year. That's 1 out of every 20 deaths. Neurologist Dr. Kevin Attenhofer outlines the signs of strokes and what you need to do right away if you notice symptoms.
Stroke identification is what you can see. What you can see when you see the stroke happen in somebody's face, in their arms, in their legs. A lot of times what we look for is we look for facial drooping. We look for somebody who is weak in their arm or leg or both. Usually one-sided, but doesn't have to be, so they might have right arm and right leg weakness. Along with facial drooping comes slurring of the speech. Those are probably the most common signs, but there are other signs. Somebody might get a really bad headache, in fact the worst headache of their life. So they might have double vision or loss of vision. They might not be able to see one entire side of their world. They might not realize that they're having a stroke, so they might be dragging their leg. A lot of times people will have dizziness, especially a sensation of room spinning or what we call vertigo. Other symptoms might be sensory, so they might feel numbness or even tingling. They might lose their language centers. So the way I describe this to patients are they lose English or their primary language. But probably the most important sign of stroke is that it usually happens all of a sudden. So it's a sudden change.
Management of a stroke starts with the patient getting emergency care.
The first thing that happens or should happen is to pick up a phone and call 911. This is not a time to put somebody in the car and drive them to the hospital. Calling 911 starts a chain of events at the hospital that you don't even see in the background. Time is everything with stroke, and so we want to be operating in parallel. One nurse drawing labs while another nurse is getting vital signs. One doctor is talking to EMS or talking to a family member. Another doctor is examining you. There are two types of stroke that can present with the exact same symptoms. One where there's blood in the brain and one where there's not blood in the brain. And in fact, the second one is caused by a blood clot or blockage of blood to the brain. Those are treated very differently. So the first step in management is to find out which one of those you're having. One treatment is a drug called Alteplase or TPA. This is a drug that's, I describe to patients as kind of roto-rooter for the pipes of the brain. If there's a clog in there, a blood clot, it goes in and tries to dissolve it. It's a one-time IV dose that we give, and it requires the supervision of the ICU. If you're a candidate for this medicine, we have about 3 hours to 4.5 hours to give it to you. Otherwise, the risk of the medicine actually outweighs the benefit. And so we really want to be focused and quick about giving you that medicine. If you're not a candidate for that medicine, for whatever reason, there are other options. We do actually have surgery where they can go in similar to what they do if you were having a heart attack. They can go in through usually your groin or your wrist, and they can put a catheter all the way up, and they can get all the way up to the blood vessels in the brain up here. And they can actually go in and grab the blood clot out if it's big enough for them to see. Anytime we're talking about stroke or damage to the brain, it can be a very, very serious and life-threatening situation. Although truly with our treatments, we're getting much better, and most of our patients now are able to walk out of the hospital in one form or fashion and return to kind of a normal life, or that's our goal, to get you back to as normal a life as possible.
Dr. Attenhofer discusses the steps and goals of stroke recovery.
So recovery from stroke begins early on. It begins even while you're still in the hospital. We encourage early work with therapies. So we have physical therapy, occupational therapy, speech therapy, and each of these therapists, they focus on a different part of stroke recovery. Everything is focused on getting back to life as normal, or a new normal that you can be happy with. So physical therapy, occupational therapy, speech therapy, these start in the hospital and they continue even after discharge. So I tell my patients that the stroke happens in the snap of a finger, the blink of an eye, but the recovery takes months to years even. But I also tell my patients what you give is what you get. So you really have to be engaged. Patients that have family members that are supporting them, that are really invested in their therapy, that put a lot in, they're the folks that get a lot out of therapy and really do well.